Hello, I'm Helen Normal, co-founder of My Menopause Centre, and I'm joined today by my fellow founder, the great Dr. Clare Spencer. So we're going to speak about some of the most frequently mentioned HRT myths. And Claire, let's just kick off with the first one that you hear very, very often in the clinic. HRT can cause breast cancer.
Helen, I think that's right. I think it's still in the forefront of people's minds. And what we know is this. Basically, in your 50s and beyond, there is a small increased risk of breast cancer diagnosis. But to understand it a bit more, you need to break that down. So if you've had a hysterectomy and you only need to take the hormone estrogen, then there is little or no increased risk of breast cancer. If you haven't had a hysterectomy and you need to take the two hormones, that's combined HRT, the estrogen and the progestogen, there is a small increased risk of diagnosis. And it's really important to consider this in the context of other breast cancer risk factors. So, for example, the study that we usually quote from showed that there was a higher risk of breast cancer if you drink on average 2 units of alcohol a night, which is not that much. It's a reasonable glass of wine. It's a double gin and tonic. And if you're overweight or obese, actually the risk of breast cancer doubles. So I think the take-home message in your 50s, taking combined HRT, there is a small increased risk of diagnosis, but actually other lifestyle risk factors can be more important. The other thing that I just want to call out is that if you take HRT under the age of 50, it probably doesn't do anything to your risk of breast cancer. It doesn't increase your risk above population risk. So in terms of starting the clock, because we know the longer you take HRT for, the greater the risk of breast cancer diagnosis. That clock doesn't start until you're in your 50s. So for the women under the age of 50 taking HRT, it's fine. You just take it until you're 50, and then that's when the clock would start in terms of that small increase in risk.
Okay, so that's great, Claire, very clear. So basically what we're saying is the big headline myth of HRT causes breast cancer is much more nuanced than that. Over the age of 50, there is a risk, but it's very small, much bigger risk around drinking more than a modest glass of wine or a gin and tonic in an evening. So very, very helpful. And Claire, one of the other myths that we hear then as well is that taking HRT causes blood clots or stroke. Is that true?
Yeah, and you'll read it in the packet when you open your HRT. So if you swallow estrogen, if you take estrogen orally, it does increase your risk of blood clots. It does increase your risk of stroke by a small amount, but actually your baseline starting risk is very small. So although the risk might double, it goes from a low risk to a higher low risk, if you see what I mean. So that myth does apply to oral estrogen, but the risk is still going to be low for the vast majority of women. If you have HRT through your skin, so you take your estrogen as a patch, as a gel, or the slightly newer spray, that doesn't do anything to your risk of blood clots or stroke. So, for example, if you smoke or if you are carrying a little extra weight around or obese, your risk of blood clots will increase, but having the estrogen through your skin won't further increase your risk.
Got it. Great.
So I hope that makes sense. Again, it's in the nuance, it's in the type of HRT that you're taking.
Yeah, no, very clear, Claire. Really, really helpful, but also showing just it's a very, very small risk. And I think, I suppose, reinforces the point. It's important to speak to a specialist, particularly speaking to a menopause specialist about this. Now, one of the other myths or things that we hear actually quite a lot is that you can only take HRT for 5 years or up until the age of 60, and that for women over 60, they shouldn't take HRT. Is that true, Claire?
No, again, I think it's really up to the individual. So in terms of where we're at, why would people think that? So I've already said that small increased risk of breast cancer increases the longer that you take HRT for. It's still small, but it increases with time on HRT. So it's not like there's a cutoff at 5 years when the risk suddenly zooms up. And again, it's not when you get to 60, the risk suddenly zooms up. Your background risk of blood clots and stroke will increase slowly with age. You know, the background risk of breast cancer increases slowly with age. But I would say it's really up to the individual. If your HRT is making you feel good and keeping you able to live your full best life, then really there's no need to stop it, as long as you understand how those risks, small risks, apply to you. So again, it's good to have a year-on-year discussion with your GP or a menopause specialist about what you want to do for the year ahead.
Great, thanks, Claire. That again, really, really helpful. And I think it's a very important message for women to hear. Particularly, I know we've had lots of calls in and emails in from women into the clinic saying, can I take HRT over the age of 60? And they've been told, you know, even by their doctors, that it's not possible. So again, reinforcing the importance of speaking to, you know, a doctor who really understands this area. Another question that we often get is, I'm in my 40s, am I too young to take HRT, or do I need to wait until my periods have stopped before I can take HRT? Is there any truth to that, Claire?
Yeah, I hear that a lot too, and it's a real shame because women are denying a really effective form of treatment for their symptoms. So no, so you can start HRT while you're still having periods, but you need to start the type of HRT called sequential HRT, where you still continue to have periods unless you have a Mirena coil fit. I've tried to lay that out really clearly to explain what that means on our website if you go to the HRT section. So you can start HRT if you're still having periods. You're never too young really to start HRT, and actually if you have a menopause under the age of 40, it's really important that you take HRT, because it will significantly reduce your risk of heart disease. It will significantly reduce your risk of osteoporosis, so thinning of the bones and fractures, and also dementia. If you start HRT early in the menopause, if you have an early menopause, it's likely to reduce your risk of dementia. So it's really important actually that people start it if they're having a menopause at a younger age. And, you know, we know the perimenopause symptoms can start in your early 40s, and why deny yourself something that could help, and it's got the benefits in helping prevent osteoporosis and heart disease. So, yeah, I would say you're not too young and it's fine.
Yeah, great. Thank you, Claire. And then last myth, I think, that, you know, question that we hear a lot is that there's not really much point in taking HRT because it only delays the inevitable.
Yeah, I hear that a lot, and it's quite tricky to explain, but basically HRT treats your symptoms at the age that you're having them. It doesn't press a pause button on your menopause. So if you decide to stop HRT, for example, at the age of, I don't know, 56, 57, you'll feel at that age how you were sort of programmed to feel anyway at that age. So you won't necessarily have all your symptoms swamping back at you. But if you're somebody who is likely to have symptoms for a longer time, then you will get some symptoms back and you might want to restart it. It's really tricky. There isn't a test that you can do to find out how long you're going to have symptoms for or whether they've settled or not. You just sort of have to try it and see what happens. It's a bit of trial and error, I would say.
Okay, great. Thank you, Claire. I think, again, a really important message because I think certainly some of my friends that I've spoken to, and I know you and the other doctors hear it as well, if you feel that it's just pushing into the future symptoms that you're going to experience, it's understandable why you'd think there's no point in taking it, but it's totally not true. And it can absolutely help you in the moment. So a very important myth, I think, to bust. So look, that was great, Claire. We've covered some of the key myths around HRT and this. We also have a blog on the website about HRT myths and a load of great, you know, evidence and information about HRT in our website, the benefits, the risks, and so on. So if you're looking for, you know, if viewers are looking for more information about that, then I think our website is a great resource and a great place for them to go. And of course, everything written by you. Thank you so much, Claire, and thank you for joining us today. Bye-bye.
Bye.